1. Insulin is secreted by the alpha cells of the pancreas. True or false? Answer: false rationale. Insulin is produced by beta cells in the pancreatic islets, while alpha cells secrete glucagon. This distinction is vital for understanding diabetes pathophysiology, as beta cell dysfunction is central to diabetes. 2. A blood glucose level of 45 milligrams per deciliter in an alert patient requires immediate treatment with fast-acting carbohydrates. True or false? Answer: true rationale. A blood glucose of 45 milligrams per deciliter indicates hypoglycemia, and in an alert patient, 15 grams of fast-acting carbohydrates, e.g., juice, is the first-line treatment to prevent complications like seizures. 3. Metformin is contraindicated in patients with severe renal impairment. True or false? Answer: true rationale. Metformin is cleared by the kidneys, and severe renal impairment increases the risk of lactic acidosis, a rare but serious complication, making it contraindicated in such patients. 4. Diabetic ketoacidosis, DKA, is more common in type 2 diabetes than type 1 diabetes. True or false? Answer: false rationale. DKA is primarily associated with type 1 diabetes due to absolute insulin deficiency, leading to ketone production. It is less common in type 2 diabetes, where insulin resistance is predominant. 5. Daily foot inspections are recommended for diabetic patients to prevent complications. True or false? Answer: true rationale. Daily foot inspections help detect cuts, blisters, or infections early, reducing the risk of ulcers and amputations in diabetic patients with neuropathy or poor wound healing. 6. Insulin glargine can be mixed with regular insulin in the same syringe. True or false? Answer: false rationale. Glargine's unique pH makes it incompatible with other insulins. Mixing alters its action, leading to unpredictable glucose control, so separate injections are required. 7. Exercise is safe for a patient with a blood glucose of 300 milligrams per deciliter and no ketones. True or false? Answer: false rationale. A blood glucose above 250 milligrams per deciliter indicates poor control, and exercise may exacerbate hyperglycemia or stress metabolism, even without ketones, until glucose is lowered. 8. HbA1c levels reflect blood glucose control over the past 6 months. True or false? Answer: false rationale. HbA1c reflects average blood glucose over 2 to 3 months, corresponding to the lifespan of red blood cells, making it a key marker for long-term diabetes management. 9. Glucagon is the first-line treatment for hypoglycemia in a patient who can swallow. True or false? Answer: false rationale. For alert patients who can swallow, fast-acting carbohydrates, e.g., glucose tablets, are the first-line treatment for hypoglycemia. Glucagon is used for unconscious patients. 10. Carbohydrate counting is primarily used in type 1 diabetes to calculate insulin doses. True or false? Answer: true rationale. Carbohydrate counting allows type 1 diabetes patients to match bolus insulin doses to meal intake, ensuring precise glucose control, though it may also benefit type 2 patients. 11. Hypoglycemia can cause symptoms like shakiness and sweating. True or false? Answer: true rationale. Hypoglycemia triggers sympathetic responses, causing shakiness, sweating, and anxiety as the body attempts to raise glucose levels, requiring prompt treatment. 12. Type 2 diabetes is always managed with insulin therapy. True or false? Answer: false rationale. Type 2 diabetes is often managed with lifestyle changes, oral medications, e.g., metformin, or non-insulin injectables initially, with insulin reserved for advanced cases. 13. A patient with diabetic neuropathy should avoid wearing tight shoes. True or false? Answer: true rationale. Tight shoes can cause pressure injuries or ulcers in patients with neuropathy who may not feel discomfort, increasing infection risk. 14. Insulin aspart has a peak action within 30 minutes of injection. True or false? Answer: false rationale. Insulin aspart, rapid-acting insulin, peaks at 1 to 2 hours, not within 30 minutes, aligning with postprandial glucose rises for effective control. 15. Diabetic retinopathy can be prevented by maintaining strict blood glucose control. True or false? Answer: true. Rationale: tight glucose control reduces microvascular damage to retinal blood vessels, slowing or preventing the progression of diabetic retinopathy. 16. A blood glucose of 180 milligrams per deciliter 2 hours after a meal is within the normal range for diabetic patients. True or false? Answer: false. Rationale: postprandial glucose should ideally be below 180 milligrams per deciliter in diabetic patients to minimize complications, indicating a need for treatment adjustment. 17. Patients with diabetes should avoid all carbohydrates to manage their condition. True or false? Answer: false. Rationale: carbohydrates are essential for energy, but patients should focus on complex, low glycemic index carbs and portion control to stabilize glucose levels. 18. Hyperglycemic hyperosmolar state, HHS, is more common in type 1 diabetes than type 2. True or false? Answer: false. Rationale: HHS is more common in type 2 diabetes, often in older adults, due to severe hyperglycemia and dehydration without significant ketosis. 19. Insulin pens should be primed before each injection. True or false? Answer: true. Rationale: priming removes air bubbles from the insulin pen needle, ensuring accurate dosing and preventing hyperglycemia or hypoglycemia. 20. A patient with a blood glucose of 40 milligrams per deciliter who is unresponsive should receive oral glucose. True or false? Answer: false. Rationale: unresponsive patients cannot safely swallow, so glucagon or 4-dextrose is used to treat severe hypoglycemia, ensuring rapid glucose elevation. 21. Regular insulin can be administered intravenously in emergencies. True or false? Answer: true. Rationale: regular insulin is the only insulin safe for use, commonly used in DKA or HHS to rapidly lower blood glucose in critical settings. 22. Diabetic nephropathy is primarily caused by poor blood pressure control. True or false? Answer: false. Rationale: diabetic nephropathy results from chronic hyperglycemia damaging kidney vessels, though poor blood pressure control exacerbates the condition. 23. Patients with diabetes should check their blood glucose only once daily. True or false? Answer: false. Rationale: frequency of glucose monitoring depends on the patient's regimen, but multiple daily checks are often needed, especially for type 1 diabetes or insulin users. 24. Insulin detamere has a pronounced peak action like regular insulin. True or false? Answer: false. Rationale: detamere is a long-acting insulin with no significant peak, providing steady basal coverage, unlike regular insulin, which peaks at 2 to 4 hours. 25. Continuous glucose monitoring (CGM) systems require calibration with fingerstick tests. True or false? Answer: true. Rationale: many CGM systems require periodic calibration with fingerstick glucose tests to ensure accuracy, though some newer models are calibration-free. 26. A patient with type 1 diabetes can skip insulin doses if they are not eating. True or false? Answer: false. Rationale: type 1 diabetes requires continuous insulin, basal and bolus, to prevent hyperglycemia and DKA, even during fasting periods. 27. Sulfonylureas like glipizide increase insulin sensitivity in type 2 diabetes. True or false? Answer: false. Rationale: sulfonylureas stimulate pancreatic beta cells to release insulin, not increase insulin sensitivity, which is the mechanism of drugs like metformin. 28. Diabetic foot ulcers are primarily caused by poor glucose control. True or false? Answer: true. Rationale: chronic hyperglycemia leads to neuropathy and poor wound healing, major contributors to diabetic foot ulcers, exacerbated by trauma or infection. 29. A blood glucose of 100 milligrams per deciliter before a meal requires insulin administration in type 2 diabetes. True or false? Answer: false. Rationale: a premeal glucose of 100 milligrams per deciliter is within target range, 80 to 130 mg/dl, for most diabetic patients, typically not requiring immediate insulin. 30. Patients with diabetes should avoid exercise due to the risk of hypoglycemia. True or false? Answer: false rationale. Exercise is beneficial for diabetes management but requires precautions like glucose monitoring and snacks to prevent hypoglycemia. 31. Fruity breath odor is a symptom of hypoglycemia. True or false? Answer: false rationale. Fruity breath is a sign of diabetic ketoacidosis, DKA, due to ketone production, not hypoglycemia, which causes symptoms like shakiness. 32. Insulin pumps deliver both basal and bolus insulin doses. True or false? Answer: true rationale. Insulin pumps provide continuous basal insulin and user-initiated bolus doses for meals or corrections, mimicking natural insulin secretion. 33. Type 1 diabetes is caused by insulin resistance. True or false? Answer: false rationale. Type 1 diabetes results from autoimmune destruction of pancreatic beta cells, leading to insulin deficiency, not insulin resistance. 34. A patient with a blood glucose of 200 milligrams per deciliter should drink water to manage hyperglycemia. True or false? Answer: true rationale. Hydration helps dilute blood glucose and promotes renal glucose excretion, complementing insulin therapy in hyperglycemia management. 35. Diabetic neuropathy can cause numbness in the hands and feet. True or false? Answer: true rationale. Peripheral neuropathy, a common diabetes complication, causes numbness due to nerve damage from chronic hyperglycemia, increasing injury risk. 36. Metformin is the first-line treatment for type 1 diabetes. True or false? Answer: false rationale. Type 1 diabetes requires insulin therapy due to absolute insulin deficiency, while metformin is used for type 2 diabetes to improve insulin sensitivity. 37. A patient with a diabetic foot ulcer should soak their feet daily to promote healing. True or false? Answer: false rationale. Soaking can soften skin and increase infection risk in diabetic foot ulcers. Keeping the area clean and dry is recommended instead. 38. Kussmaul respirations are a sign of diabetic ketoacidosis. True or false? Answer: true rationale. Kussmaul respirations, rapid, deep breathing, occur in DKA as the body attempts to compensate for metabolic acidosis by eliminating carbon dioxide. 39. Insulin should be stored in the freezer to maintain potency. True or false? Answer: false rationale. Insulin should be stored in the refrigerator, unopened, or at room temperature, opened, for up to 28 days, as freezing can denature it. 40. A patient with type 2 diabetes can develop hyperglycemic hyperosmolar state, HHS. True or false? Answer: true rationale. HHS is a complication of type 2 diabetes, characterized by extreme hyperglycemia and dehydration, often in older adults with comorbidities. 41. Rotating insulin injection sites prevents lipohypertrophy. True or false? Answer: true rationale. Rotating sites prevents fat tissue buildup, lipohypertrophy, which impairs insulin absorption, ensuring consistent glucose control. 42. A blood glucose of 70 milligrams per deciliter is considered hypoglycemic in diabetic patients. True or false? Answer: true rationale. A blood glucose below 70 milligrams per deciliter is defined as hypoglycemia in diabetes, requiring treatment to prevent symptoms or complications. 43. SGLT2 inhibitors like empagliflozin increase insulin production. True or false? Answer: false rationale. SGLT2 inhibitors promote glucose excretion in urine, reducing blood glucose, but do not directly increase insulin production. 44. Patients with diabetes should avoid alcohol to prevent hyperglycemia. True or false? Answer: false rationale. Alcohol can cause hypoglycemia, especially with insulin or sulfonylureas, so moderation and food pairing are advised, not complete avoidance. 45. A patient with type 1 diabetes should check for ketones during illness. True or false? Answer: true rationale. Illness can raise glucose and ketone levels in type 1 diabetes, increasing DKA risk, so ketone testing guides timely intervention. 46. GLP-1 agonists like liraglutide are used only in type 1 diabetes. True or false? Answer: false rationale. GLP-1 agonists are primarily used in type 2 diabetes to enhance insulin secretion and slow gastric emptying, not in type 1 diabetes. 47. A diabetic patient with a blood glucose of 250 milligrams per deciliter should eat a high-carbohydrate meal. True or false? Answer: false rationale. A glucose of 250 milligrams per deciliter indicates hyperglycemia, requiring insulin or other interventions, not a high-carb meal, which would worsen it. 48. Regular eye exams can detect diabetic retinopathy early. True or false? Answer: true rationale. Annual eye exams detect early retinal changes in diabetic retinopathy, allowing interventions to prevent vision loss. 49. Insulin syringes can be reused if cleaned properly. True or false? Answer: false rationale. Reusing syringes increases infection risk and reduces needle sharpness, leading to pain and inconsistent insulin delivery. 50. Patient education on sick day rules includes stopping insulin during illness. True or false? Answer: false rationale. Insulin must continue during illness, even if eating less, to prevent hyperglycemia or DKA with frequent glucose and ketone monitoring. 51. A patient with type 1 diabetes can develop insulin resistance over time. True or false? Answer: true rationale. While type 1 diabetes is primarily due to insulin deficiency, some patients develop insulin resistance, often related to obesity or puberty, requiring higher insulin doses for control. 52. A blood glucose of 65 milligrams per deciliter in a diabetic patient requires no intervention if asymptomatic. True or false? Answer: true rationale. A blood glucose of 65 milligrams per deciliter is below the normal range, 70 to 130 mg/dl, but asymptomatic patients may not need immediate treatment unless trending lower, though monitoring is advised. 53. Metformin increases the risk of hypoglycemia when used alone. True or false? Answer: false rationale. Metformin works by reducing hepatic glucose production and improving insulin sensitivity, not stimulating insulin release, so it rarely causes hypoglycemia as a monotherapy. 54. Hyperglycemia can cause fatigue in diabetic patients. True or false? Answer: true rationale. Hyperglycemia leads to dehydration and reduced cellular glucose uptake, causing fatigue, a common symptom requiring glucose control to resolve. 55. Patients with diabetes should use lotion between their toes to prevent dry skin. True or false? Answer: false rationale. Lotion between toes can trap moisture, increasing fungal infection risk in diabetic patients, who should keep interdigital areas dry. 56. Insulin Lispro should be administered 30 minutes before meals. True or false? Answer: false rationale. Lispro, a rapid-acting insulin, is given within 15 minutes before or immediately after meals to match postprandial glucose spikes effectively. 57. Diabetic ketoacidosis, DKA, can be triggered by missed insulin doses. True or false? Answer: true rationale. Missed insulin doses in type 1 diabetes lead to uncontrolled hyperglycemia and ketone production, precipitating DKA, a life-threatening condition. 58. A patient with a blood glucose of 200 milligrams per deciliter before bed should skip their snack. True or false? Answer: false rationale. A bedtime snack may still be needed to prevent nocturnal hypoglycemia, especially if on insulin, but the snack should be balanced to avoid worsening hyperglycemia. 59. Continuous glucose monitors, CGMs, eliminate the need for fingerstick tests entirely. True or false? Answer: false rationale. While CGMs reduce fingerstick frequency, many require occasional calibration or confirmation tests, especially for treatment decisions like insulin dosing. 60. A patient with a diabetic foot ulcer should walk barefoot to air out the wound. True or false? Answer: false rationale. Walking barefoot increases trauma and infection risk in diabetic foot ulcers, which require protection and offloading to heal properly. 61. Type 2 diabetes is always preventable with lifestyle changes. True or false? Answer: false rationale. While lifestyle changes reduce type 2 diabetes risk, genetic and environmental factors mean it's not always preventable, though onset can often be delayed. 62. A blood glucose of 400 milligrams per deciliter requires immediate insulin administration in all diabetic patients. True or false? Answer: false rationale. Hyperglycemia of 400 milligrams per deciliter requires intervention, but the approach depends on the patient's condition, type of diabetes, and ketone status, not always immediate insulin. 63. Insulin glargine provides basal insulin coverage for up to 24 hours. True or false? Answer: true rationale. Glargine is a long-acting insulin with a duration of up to 24 hours, providing steady basal coverage to maintain glucose stability. 64. Hypoglycemia can cause seizures in severe cases. True or false? Answer: true rationale. Severe hypoglycemia, e.g., below 40 milligrams per deciliter, can impair brain function, leading to seizures if untreated, requiring urgent glucose elevation. 65. Patients with diabetes should avoid all forms of sugar completely. True or false? Answer: false rationale. Moderation, not elimination, of sugar is advised, with focus on complex carbohydrates and glycemic index to maintain stable glucose levels. 66. Diabetic retinopathy only occurs in patients with type 1 diabetes. True or false? Answer: false rationale. Diabetic retinopathy affects both type 1 and type 2 diabetes patients, caused by chronic hyperglycemia damaging retinal blood vessels. 67. A patient with a blood glucose of 85 milligrams per deciliter before exercise should eat a snack. True or false? Answer: true rationale. A glucose of 85 milligrams per deciliter is near the lower limit, and exercise may cause hypoglycemia, so a carbohydrate snack helps maintain safe levels. 68. Insulin detamere can be administered intravenously in emergencies. True or false? Answer: false rationale. Only regular insulin is safe for use in emergencies like DKA. Detamere, a long-acting insulin, is for subcutaneous use only. 69. HbA1c should be checked monthly to monitor diabetes control. True or false? Answer: false rationale. HbA1c reflects 2 to 3 months of glucose control, so it's typically checked every 3 to 6 months, not monthly, to assess long-term management. 70. A patient with diabetic neuropathy can safely use heating pads on their feet. True or false? Answer: false rationale. Neuropathy reduces sensation, increasing burn risk from heating pads, which can lead to undetected injuries or infections in diabetic patients. 71. Sulfonylureas like glympyride can cause weight gain. True or false? Answer: true rationale. Sulfonylureas stimulate insulin release, which can promote fat storage, leading to weight gain, a common side effect requiring monitoring. 72. A blood glucose of 150 milligrams per deciliter 2 hours after a meal is within target range for diabetic patients. True or false? Answer: true rationale. Postprandial glucose below 180 milligrams per deciliter is generally acceptable for diabetic patients, indicating good control, though targets vary individually. 73. Insulin pumps are only used in type 1 diabetes. True or false? Answer: false rationale. While common in type 1 diabetes, insulin pumps are also used in some type 2 diabetes patients requiring intensive insulin therapy for better control. 74. Hyperglycemic hyperosmolar state, HHS, is treated primarily with glucagon. True or false? Answer: false rationale. HHS is treated with 4 fluids, insulin, and electrolyte correction to address hyperglycemia and dehydration, not glucagon, which raises glucose. 75. Patients with diabetes should trim their own calluses to prevent foot complications. True or false? Answer: false rationale. Self-trimming calluses risks injury or infection, especially with neuropathy. Professional care by a podiatrist is safer for diabetic patients. 76. A blood glucose of 50 milligrams per deciliter can cause confusion in a diabetic patient. True or false? Answer: true. Rationale: hypoglycemia below 70 milligrams per deciliter, especially at 50 milligrams per deciliter, impairs brain glucose supply, leading to confusion, requiring immediate treatment. 77. Insulin aspart is a long-acting insulin used for basal coverage. True or false? Answer: false. Rationale: aspart is a rapid-acting insulin for mealtime or correction doses, not basal coverage, which is provided by insulins like glargine or detamir. 78. Diabetic nephropathy can be detected early with urine albumin tests. True or false? Answer: true. Rationale: microalbuminuria testing detects early kidney damage in diabetic nephropathy, allowing interventions to slow progression. 79. A patient with type 1 diabetes should stop insulin during illness if unable to eat. True or false? Answer: false. Rationale: insulin must continue during illness to prevent hyperglycemia or DKA, with adjustments based on glucose and ketone monitoring. 80. GLP-1 agonists like exenatide can slow gastric emptying. True or false? Answer: true. Rationale: GLP-1 agonists slow gastric emptying, reducing postprandial glucose spikes, a key mechanism in type 2 diabetes management. 81. A blood glucose of 250 milligrams per deciliter requires ketone testing in type 1 diabetes. True or false? Answer: true. Rationale: glucose above 250 milligrams per deciliter in type 1 diabetes may indicate insulin deficiency, and ketone testing helps detect early DKA risk. 82. Diabetic patients should avoid checking blood glucose during the night. True or false? Answer: false. Rationale: nighttime glucose checks may be needed, especially for insulin users, to detect and prevent nocturnal hypoglycemia or hyperglycemia. 83. Regular insulin peaks 6 to 8 hours after injection. True or false? Answer: false. Rationale: regular insulin peaks at 2 to 4 hours, making it suitable for postprandial glucose control, not 6 to 8 hours, which is typical for NPH insulin. 84. A patient with a diabetic foot ulcer should use antibiotic cream without consulting a provider. True or false? Answer: false. Rationale: antibiotic creams require provider guidance to ensure appropriate use, as improper treatment can worsen diabetic foot ulcers or delay healing. 85. Hypoglycemia is more common with metformin than sulfonylureas. True or false? Answer: false. Rationale: sulfonylureas stimulate insulin release, increasing hypoglycemia risk, while metformin does not, making it safer in this regard. 86. Diabetic retinopathy can lead to blindness if untreated. True or false? Answer: true. Rationale: untreated diabetic retinopathy damages retinal vessels, progressing to vision loss or blindness, underscoring the need for regular eye exams. 87. A blood glucose of 90 milligrams per deciliter before a meal requires treatment in type 1 diabetes. True or false? Answer: false. Rationale: a premeal glucose of 90 milligrams per deciliter is within target range, 80 to 130 mg/dl, requiring no immediate treatment, though meal insulin may be needed. 88. Insulin pens should be stored in the refrigerator after opening. True or false? Answer: false. Rationale: opened insulin pens can be stored at room temperature for up to 28 days, improving convenience while maintaining potency. 89. Exercise can improve insulin sensitivity in type 2 diabetes. True or false? Answer: true. Rationale: exercise enhances muscle glucose uptake, reducing insulin resistance and improving glycemic control in type 2 diabetes. 90. A patient with type 2 diabetes always requires insulin within 5 years of diagnosis. True or false? Answer: false. Rationale: many type 2 diabetes patients manage with lifestyle changes or oral medications for years, with insulin needed only if control worsens. 91. Kussmaul respirations are a sign of hypoglycemia. True or false? Answer: false rationale. Kussmaul respirations occur in DKA, a hyperglycemic complication, as the body compensates for acidosis, not in hypoglycemia. 92. A patient with diabetes should check their HbA1c daily to monitor glucose control. True or false? Answer: false rationale. HbA1c monitors long-term, 2 to 3 months, glucose control and is checked every 3 to 6 months, not daily, unlike blood glucose tests. 93. Insulin NPH is a clear insulin that does not require mixing. True or false? Answer: false rationale. NPH is a cloudy insulin requiring gentle mixing to ensure uniform suspension, unlike clear insulins like regular or glargine. 94. A blood glucose of 180 milligrams per deciliter at bedtime requires immediate insulin in all diabetic patients. True or false? Answer: false rationale. A bedtime glucose of 180 milligrams per deciliter may require insulin based on the patient's regimen, but other factors like trends or ketones guide treatment. 95. Diabetic neuropathy can affect the autonomic nervous system. True or false? Answer: true rationale. Autonomic neuropathy in diabetes can cause issues like gastroparesis or orthostatic hypotension, resulting from chronic hyperglycemia. 96. A patient with type 1 diabetes can safely fast for 24 hours without insulin. True or false? Answer: false rationale. Fasting without insulin in type 1 diabetes risks hyperglycemia and DKA due to ongoing glucose production, requiring basal insulin. 97. SGLT2 inhibitors increase the risk of urinary tract infections. True or false? Answer: true rationale. SGLT2 inhibitors promote glucose excretion in urine, creating a favorable environment for urinary tract infections, requiring patient monitoring. 98. A diabetic patient with a blood glucose of 300 milligrams per deciliter should drink sugary beverages. True or false? Answer: false rationale. Hyperglycemia requires insulin and hydration with water, not sugary beverages, which would worsen glucose levels. 99. Regular insulin can be used in insulin pumps. True or false? Answer: true rationale. Rapid-acting insulins like regular insulin or analogs, e.g., Aspart, are used in pumps for precise basal and bolus delivery, though analogs are more common. 100. Patient education on diabetes includes teaching about the importance of regular dental checkups. True or false? Answer: true rationale. Diabetes increases gum disease risk due to impaired immune responses, making regular dental checkups critical for oral health. 101. A patient with type 1 diabetes should check their blood glucose only before meals. True or false? Answer: false rationale. Type 1 diabetes patients often need to check glucose multiple times daily, including before meals, bedtime, and as needed, e.g., during illness or exercise, to maintain control. 102. Hypoglycemia can cause irritability and difficulty concentrating. True or false? Answer: true rationale. Hypoglycemia impairs brain glucose supply, leading to neuroglycopenic symptoms like irritability and poor concentration, requiring prompt carbohydrate administration. 103. Metformin is commonly used to treat diabetic ketoacidosis, DKA. True or false? Answer: false rationale. DKA requires insulin and 4 fluids to correct hyperglycemia and acidosis. Metformin, used for type 2 diabetes, is not indicated for DKA treatment. 104. A blood glucose of 220 milligrams per deciliter in a type 2 diabetic patient always requires hospitalization. True or false? Answer: false rationale. A glucose of 220 milligrams per deciliter indicates hyperglycemia but may be managed outpatient with insulin or oral medications, depending on symptoms and patient status. 105. Diabetic patients should avoid cutting their own toenails to prevent injury. True or false? Answer: true rationale. Neuropathy and poor healing increase injury risk when diabetic patients cut toenails, so professional podiatric care is recommended to prevent infections. 106. Insulin glucosine has a duration of action up to 24 hours. True or false? Answer: false rationale. Glucose, a rapid-acting insulin, lasts 3 to 5 hours, covering mealtime glucose spikes, unlike long-acting insulins like glargine, which last up to 24 hours. 107. Hyperglycemic hyperosmolar state, HHS, can cause seizures due to severe dehydration. True or false? Answer: true rationale. HHS causes extreme dehydration, which can lead to electrolyte imbalances and seizures, requiring urgent fluid and insulin therapy. 108. A patient with a blood glucose of 75 milligrams per deciliter before exercise should delay activity. True or false? Answer: true rationale. A glucose of 75 milligrams per deciliter is near hypoglycemic levels, and exercise may lower it further, so a snack is needed to raise glucose before activity. 109. Continuous glucose monitors, CGMs, can alert patients to impending hypoglycemia. True or false? Answer: true rationale. CGMs track glucose trends and can alarm for low or falling glucose levels, helping patients act early to prevent hypoglycemia. 110. A diabetic foot ulcer can heal without medical intervention. True or false? Answer: false rationale. Diabetic foot ulcers require professional care, e.g., debridement, offloading, due to poor healing and infection risk from neuropathy and hyperglycemia. 111. Type 2 diabetes is caused solely by genetic factors. True or false? Answer: false rationale. Type 2 diabetes results from a combination of genetic predisposition, obesity, and lifestyle factors, not genetics alone, allowing prevention through lifestyle changes. 112. A blood glucose of 350 milligrams per deciliter in type 1 diabetes requires ketone testing. True or false? Answer: true rationale. Glucose above 250 milligrams per deciliter in type 1 diabetes may indicate insulin deficiency, and ketone testing detects early DKA risk, guiding urgent treatment. 113. Insulin detamere should be shaken vigorously before injection. True or false? Answer: false rationale. Detamere is a clear insulin that does not require shaking. Vigorous shaking can damage insulin, reducing its effectiveness and affecting glucose control. 114. Hypoglycemia can be prevented by eating meals on a regular schedule. True or false? Answer: true rationale. Regular meals ensure consistent glucose availability, reducing hypoglycemia risk, especially for patients on insulin or sulfonylureas. 115. Patients with diabetes should consume high-fat meals to avoid glucose spikes. True or false? Answer: false rationale. High-fat meals can delay glucose absorption but contribute to insulin resistance and cardiovascular risk, so balanced meals are preferred. 116. Diabetic retinopathy is reversible with laser surgery. True or false? Answer: false rationale. Laser surgery slows diabetic retinopathy progression but cannot reverse existing damage, highlighting the need for early glucose control. 117. A blood glucose of 100 milligrams per deciliter at bedtime requires a snack in all diabetic patients. True or false? Answer: false rationale. A glucose of 100 milligrams per deciliter is normal, and snacks depend on the patient's insulin regimen, activity, and hypoglycemia risk, not a universal need. 118. Insulin aspart can be used to treat hyperglycemic emergencies like DKA. True or false? Answer: false rationale. Regular insulin is used for DKA due to its predictable action. Aspart, a rapid-acting insulin, is for subcutaneous use and not suitable for emergencies. 119. HbA1c levels below 7% indicate good diabetes control for most patients. True or false? Answer: true rationale. An HbA1c below 7% reflects good long-term glucose control, reducing complication risks, though individual targets may vary. 120. A patient with diabetic neuropathy should use cold packs to relieve foot pain. True or false? Answer: false rationale. Cold packs can reduce sensation further in neuropathy, risking injury, and diabetic patients should avoid temperature extremes on their feet. 121. Sulfonylureas like glyburide are safe for patients with sulfa allergies. True or false? Answer: false rationale. Sulfonylureas contain sulfa compounds, and patients with sulfa allergies may have cross-reactivity, requiring alternative medications. 122. A blood glucose of 160 milligrams per deciliter 1 hour after a meal is within target range. True or false? Answer: true rationale. 1 hour postprandial glucose below 180 milligrams per deciliter is generally acceptable for diabetic patients, though targets depend on individual goals. 123. Insulin pumps require daily site changes to prevent infection. True or false? Answer: false rationale. Pump infusion sites are typically changed every 2 to 3 days, not daily, to prevent infection and ensure consistent insulin absorption. 124. Hyperglycemic hyperosmolar state, HHS, has a higher mortality rate than DKA. True or false? Answer: true rationale. HHS has a higher mortality rate, 10 to 20%, than DKA due to severe dehydration, older patient age, and comorbidities, requiring aggressive treatment. 125. Diabetic patients should avoid moisturizing their feet to prevent infections. True or false? Answer: false rationale. Moisturizing prevents skin cracks and infections, but it should be avoided between toes to prevent fungal growth in diabetic patients. 126. A blood glucose of 45 milligrams per deciliter can cause loss of consciousness. True or false? Answer: true rationale. Severe hypoglycemia, below 50 milligrams per deciliter, can impair brain function, leading to unconsciousness if untreated, requiring urgent intervention. 127. Insulin Lispro is a cloudy insulin requiring mixing before use. True or false? Answer: false rationale. Lispro is a clear, rapid-acting insulin that does not require mixing, unlike cloudy insulins like NPH, ensuring proper administration. 128. Diabetic nephropathy increases the risk of cardiovascular disease. True or false? Answer: true rationale. Nephropathy reflects systemic microvascular damage, which also raises cardiovascular risk, a major concern in diabetic patients. 129. A patient with type 1 diabetes can skip basal insulin if fasting. True or false? Answer: false rationale. Basal insulin is essential in type 1 diabetes to prevent hyperglycemia and ketosis, even during fasting, as the body continues glucose production. 130. GLP-1 agonists like dulaglutide can cause weight loss. True or false? Answer: true rationale. GLP-1 agonists promote satiety and slow gastric emptying, often leading to weight loss, a beneficial effect in type 2 diabetes management. 131. A blood glucose of 280 milligrams per deciliter requires immediate exercise to lower it. True or false? Answer: false rationale. Glucose above 250 milligrams per deciliter may indicate insulin deficiency, and exercise could worsen hyperglycemia or trigger DKA, requiring insulin first. 132. Diabetic patients should have annual dental exams to prevent complications. True or false? Answer: true rationale. Diabetes increases gum disease risk, and annual dental exams detect issues early, preventing infections that could affect glucose control. 133. Regular insulin is the only insulin used in insulin drips. True or false? Answer: true rationale. Regular insulin's predictable kinetics make it the standard for 4 drips in emergencies like DKA, ensuring rapid and controlled glucose reduction. 134. A diabetic foot ulcer should be covered with a tight bandage to promote healing. True or false? Answer: false rationale. Tight bandages can reduce blood flow, worsening diabetic foot ulcers, which require loose, protective dressings and medical care. 135. Hypoglycemia is a common side effect of SGLT2 inhibitors. True or false? Answer: false rationale. SGLT2 inhibitors lower glucose by urinary excretion, rarely causing hypoglycemia unless combined with insulin or sulfonylureas. 136. Diabetic retinopathy can be asymptomatic in its early stages. True or false? Answer: true. Rationale: early diabetic retinopathy often has no symptoms, making regular eye exams critical to detect and treat it before vision loss occurs. 137. A blood glucose of 80 milligrams per deciliter before a meal requires carbohydrate intake. True or false? Answer: false. Rationale: a glucose of 80 milligrams per deciliter is within target range, 80 to 130 mg/dl, for pre-meal levels, requiring no immediate carbohydrates unless other factors apply. 138. Insulin pens should be discarded after one use. True or false? Answer: false. Rationale: insulin pens are reusable for multiple doses until empty or expired, e.g., 28 days after opening, with only the needle changed per use. 139. Exercise can cause hyperglycemia in poorly controlled diabetes. True or false? Answer: true. Rationale: in uncontrolled diabetes, exercise can raise glucose due to stress hormones and glycogenolysis, especially if insulin is insufficient. 140. A patient with type 2 diabetes never requires insulin therapy. True or false? Answer: false. Rationale: some type 2 diabetes patients require insulin as beta cell function declines or to achieve control, despite initial non-insulin treatments. 141. Fruity breath is a symptom of hyperglycemia in DKA. True or false? Answer: true. Rationale: fruity breath results from acetone, a ketone produced in DKA, a hyperglycemic emergency requiring urgent insulin and fluids. 142. A patient with diabetes should check HbA1c weekly to monitor control. True or false? Answer: false. Rationale: HbA1c reflects 2 to 3 months of glucose control and is checked every 3 to 6 months, not weekly, unlike daily glucose monitoring. 143. Insulin NPH can be used for mealtime glucose control. True or false? Answer: false. Rationale: NPH is an intermediate-acting insulin for basal coverage, not suitable for rapid mealtime glucose control, which requires rapid-acting insulins. 144. A blood glucose of 200 milligrams per deciliter at bedtime requires skipping insulin. True or false? Answer: false. Rationale: a glucose of 200 milligrams per deciliter indicates hyperglycemia, often requiring insulin, e.g., correction dose, to prevent overnight complications, not skipping it. 145. Diabetic neuropathy can cause gastroparesis. True or false? Answer: true. Rationale: autonomic neuropathy in diabetes can impair stomach motility, causing gastroparesis, which affects digestion and glucose control. 146. A patient with type 1 diabetes can manage without insulin for short periods. True or false? Answer: false. Rationale: type 1 diabetes patients require continuous insulin to prevent rapid hyperglycemia and DKA, as they lack endogenous insulin production. 147. SGLT2 inhibitors can cause dehydration in diabetic patients. True or false? Answer: true. Rationale: SGLT2 inhibitors increase urinary glucose and water loss, raising dehydration risk, requiring adequate fluid intake and monitoring. 148. A diabetic patient with a blood glucose of 250 milligrams per deciliter should eat candy to stabilize glucose. True or false? Answer: false. Rationale: hyperglycemia requires insulin and hydration, not candy, which would worsen glucose levels, risking further complications. 149. Regular insulin can be stored at room temperature for up to 28 days. True or false? Answer: true. Rationale: opened regular insulin vials or pens remain stable at room temperature for 28 days, ensuring convenience without compromising potency. 150. Patient education on diabetes includes stress management to improve glucose control. True or false? Answer: true. Rationale: stress raises glucose via cortisol and adrenaline, so teaching stress management helps stabilize levels and supports diabetes management. 151. A patient with type 1 diabetes should avoid all exercise due to DKA risk. True or false? Answer: false. Rationale: Exercise is beneficial for type 1 diabetes, but requires precautions like glucose monitoring and insulin adjustments to prevent DKA or hypoglycemia. 152. Hypoglycemia can cause a rapid heart rate in diabetic patients. True or false? Answer: true. Rationale: hypoglycemia triggers a sympathetic response, increasing heart rate as the body attempts to restore glucose levels, requiring prompt treatment. 153. Metformin is safe for patients with a history of heart failure. True or false? Answer: false. Rationale: metformin is contraindicated in unstable heart failure due to the risk of lactic acidosis, though it may be used cautiously in stable cases with monitoring. 154. A blood glucose of 180 milligrams per deciliter in a type 2 diabetic patient requires no action if asymptomatic. True or false? Answer: false. Rationale: a glucose of 180 milligrams per deciliter indicates hyperglycemia, and even without symptoms, it may require insulin, oral medications, or lifestyle adjustments to prevent complications. 155. Diabetic patients should wear well-fitted shoes to prevent foot injuries. True or false? Answer: true. Rationale: well-fitted shoes reduce pressure and trauma, preventing injuries or ulcers in diabetic patients, especially those with neuropathy. 156. Insulin glargine peaks at 4 to 6 hours after injection. True or false? Answer: false. Rationale: glargine is a long-acting insulin with no significant peak, providing steady basal coverage for up to 24 hours, unlike shorter-acting insulins. 157. Hyperglycemic hyperosmolar state, HHS, is characterized by high ketone levels. True or false? Answer: false. Rationale: HHS involves severe hyperglycemia and dehydration with minimal ketosis, unlike DKA, which has significant ketone production. 158. A blood glucose of 70 milligrams per deciliter before exercise requires a carbohydrate snack. True or false? Answer: true. Rationale: a glucose of 70 milligrams per deciliter is at the hypoglycemic threshold, and exercise may lower it further, so a snack ensures safe activity. 159. Continuous glucose monitors, CGMs, are only used in type 1 diabetes. True or false? Answer: false. Rationale: CGMs are used in both type 1 and type 2 diabetes to monitor glucose trends, especially in patients on insulin or with poor control. 160. A diabetic foot ulcer should be cleaned with alcohol to prevent infection. True or false? Answer: false. Rationale: alcohol can dry and damage tissue, delaying healing. Diabetic foot ulcers require mild soap and water cleaning under medical guidance. 161. Type 2 diabetes can be reversed with significant weight loss in some patients. True or false? Answer: true. Rationale: significant weight loss can improve insulin sensitivity and normalize glucose in some type 2 diabetes patients, though it's not guaranteed for all. 162. A blood glucose of 400 milligrams per deciliter always indicates diabetic ketoacidosis, DKA. True or false? Answer: false. Rationale: while 400 milligrams per deciliter suggests severe hyperglycemia, DKA requires ketosis and acidosis confirmation, as other causes like HHS may apply. 163. Insulin detamir is a rapid-acting insulin for mealtime coverage. True or false? Answer: false. Rationale: detamir is a long-acting insulin for basal coverage, not rapid-acting like Aspart or Lispro, which are used for mealtime glucose control. 164. Hypoglycemia can be treated with diet soda in an alert patient. True or false? Answer: false. Rationale: diet soda lacks carbohydrates needed to raise glucose. Hypoglycemia requires 15 grams of fast-acting carbohydrates like juice or glucose tablets. 165. Patients with diabetes should avoid fruit due to its sugar content. True or false? Answer: false. Rationale: fruits can be part of a balanced diabetic diet if portion controlled, providing fiber and nutrients without causing significant glucose spikes. 166. Diabetic retinopathy requires immediate insulin therapy to prevent progression. True or false? Answer: false. Rationale: While glucose control slows retinopathy progression, immediate insulin is not always needed. Management depends on diabetes type and severity. 167. A blood glucose of 95 milligrams per deciliter at bedtime requires insulin in type 1 diabetes. True or false? Answer: false rationale. A glucose of 95 milligrams per deciliter is within target range, 80 to 130 mg/dl, and insulin needs depend on the regimen, not automatic administration. 168. Insulin aspart can be stored in the freezer for long-term use. True or false? Answer: false rationale. Freezing damages insulin, reducing potency. Aspart should be refrigerated unopened or kept at room temperature, opened, for up to 28 days. 169. HbA1c levels above 9% indicate poor diabetes control. True or false? Answer: true rationale. An HbA1c above 9% reflects poor long-term glucose control, increasing complication risks, and signals a need for treatment adjustment. 170. A patient with diabetic neuropathy should avoid walking to prevent foot injuries. True or false? Answer: false rationale. Walking is beneficial if done with proper footwear and foot checks, as immobility can worsen circulation, but precautions prevent injuries. 171. Sulfonylureas like glipizide can cause hypoglycemia. True or false? Answer: true rationale. Sulfonylureas stimulate insulin release, which can lower glucose excessively, especially if meals are skipped, requiring careful monitoring. 172. A blood glucose of 140 milligrams per deciliter 2 hours after a meal requires immediate insulin. True or false? Answer: false rationale. A postprandial glucose of 140 milligrams per deciliter is within acceptable range, less than 180 milligrams per deciliter, and insulin depends on the patient's regimen and trends. 173. Insulin pumps eliminate the need for multiple daily injections. True or false? Answer: true rationale. Pumps deliver continuous basal insulin and bolus doses via a catheter, replacing multiple injections for improved convenience and control. 174. Hyperglycemic hyperosmolar state, HHS, is treated with high-dose insulin alone. True or false? Answer: false rationale. HHS requires 4 fluids first to correct dehydration, followed by insulin and electrolytes, not insulin alone, to safely lower glucose. 175. Diabetic patients should use electric blankets to keep their feet warm. True or false? Answer: false rationale. Electric blankets risk burns in patients with neuropathy who may not sense heat, increasing injury and infection potential. 176. A blood glucose of 50 milligrams per deciliter can cause sweating and shakiness. True or false? Answer: true rationale. Hypoglycemia at 50 milligrams per deciliter triggers adrenergic symptoms like sweating and shakiness, signaling the need for immediate carbohydrate treatment. 177. Insulin Lispro is used for basal insulin coverage. True or false? Answer: false rationale. Lispro is a rapid-acting insulin for mealtime or correction doses, not basal coverage, which is provided by long-acting insulins like Glargine. 178. Diabetic nephropathy can be monitored with blood pressure checks. True or false? Answer: true rationale. Hypertension worsens nephropathy, and regular blood pressure monitoring helps manage kidney damage risk in diabetic patients. 179. A patient with type 1 diabetes can manage with oral medications alone. True or false? Answer: false rationale. Type 1 diabetes requires insulin due to absolute beta cell loss, and oral medications alone are insufficient to control glucose. 180. GLP-1 agonists like liraglutide can reduce cardiovascular risk. True or false? Answer: true rationale. Some GLP-1 agonists reduce cardiovascular events in type 2 diabetes by improving glucose control and promoting weight loss, per clinical trials. 181. A blood glucose of 300 milligrams per deciliter requires immediate hospitalization in type 1 diabetes. True or false? Answer: false rationale. A glucose of 300 milligrams per deciliter needs intervention, but hospitalization depends on symptoms, ketones, and response to outpatient treatment like insulin. 182. Diabetic patients should have regular eye exams every 2 years. True or false? Answer: false rationale. Annual eye exams are recommended for diabetic patients to detect retinopathy early, as it can progress without symptoms. 183. Regular insulin is cloudy and requires mixing before use. True or false? Answer: false rationale. Regular insulin is clear and does not require mixing, unlike cloudy NPH insulin, ensuring proper administration without agitation. 184. A diabetic foot ulcer can lead to amputation if untreated. True or false? Answer: true rationale. Untreated foot ulcers can become infected, leading to tissue necrosis and potential amputation, especially in diabetic patients with poor healing. 185. Hypoglycemia is a common side effect of DPP for inhibitors like sitagliptin. True or false? Answer: false rationale. DPP for inhibitors have a low hypoglycemia risk as they enhance glucose-dependent insulin release, unlike sulfonylureas or insulin. 186. Diabetic retinopathy is caused by low blood glucose levels. True or false? Answer: false rationale. Retinopathy results from chronic hyperglycemia damaging retinal vessels, not low glucose, emphasizing the need for tight control. 187. A blood glucose of 85 milligrams per deciliter before a meal requires insulin in type 2 diabetes. True or false? Answer: false rationale. A glucose of 85 milligrams per deciliter is within target range, 80 to 130 mg/dl, and insulin depends on the patient's regimen, not automatic use. 188. Insulin vials should be discarded 14 days after opening. True or false? Answer: false rationale. Opened insulin vials are stable for up to 28 days at room temperature, ensuring safe use if stored properly. 189. Exercise always lowers blood glucose in diabetic patients. True or false? Answer: false rationale. Exercise typically lowers glucose, but in uncontrolled diabetes, it can raise glucose due to stress hormones if insulin is insufficient. 190. A patient with type 2 diabetes can develop diabetic ketoacidosis, DKA. True or false? Answer: true rationale. Though rare, type 2 diabetes patients can develop DKA, especially with severe stress, infection, or SGLT2 inhibitor use, producing ketones. 191. Fruity breath odor is a symptom of hypoglycemia. True or false? Answer: false rationale. Fruity breath indicates DKA from ketone production in hyperglycemia, not hypoglycemia, which causes symptoms like tremor or confusion. 192. A patient with diabetes should check HbA1c every 3 months if poorly controlled. True or false? Answer: true rationale. Poorly controlled diabetes requires HbA1c checks every 3 months to assess treatment effectiveness and guide adjustments, per guidelines. 193. Insulin NPH is a rapid-acting insulin for postprandial control. True or false? Answer: false rationale. NPH is an intermediate-acting insulin for basal coverage, not rapid-acting for postprandial control, which requires insulins like aspart. 194. A blood glucose of 180 milligrams per deciliter at bedtime requires a high carbohydrate snack. True or false? Answer: false rationale. A glucose of 180 milligrams per deciliter indicates hyperglycemia, and a high-carb snack would worsen it. A balanced or no snack may be needed based on insulin. 195. Diabetic neuropathy can cause erectile dysfunction. True or false? Answer: true rationale. Autonomic neuropathy in diabetes can impair nerve signals for erection, contributing to erectile dysfunction, a common complication. 196. A patient with type 1 diabetes can skip insulin during a cold. True or false? Answer: false rationale. Illness increases glucose, requiring continued or increased insulin in type 1 diabetes to prevent hyperglycemia or DKA with frequent monitoring. 197. SGLT2 inhibitors can increase the risk of genital infections. True or false? Answer: true. Rationale: SGLT2 inhibitors raise urinary glucose, creating a favorable environment for yeast and bacterial infections, requiring hygiene education. 198. A diabetic patient with a blood glucose of 250 milligrams per deciliter should drink diet soda. True or false? Answer: false. Rationale: hyperglycemia requires water for hydration and insulin, not diet soda, which lacks carbohydrates but does not address high glucose. 199. Regular insulin can be used for correction doses in insulin pumps. True or false? Answer: true. Rationale: regular insulin or rapid analogs like aspart are used for correction doses in pumps to address hyperglycemia, though analogs are preferred. 200. Patient education on diabetes includes teaching about the importance of regular blood pressure checks. True or false? Answer: true. Rationale: hypertension worsens diabetic complications like nephropathy and retinopathy, making regular blood pressure monitoring essential for management. 201. A patient with type 1 diabetes can develop hypoglycemia unawareness over time. True or false? Answer: true. Rationale: frequent hypoglycemia can reduce symptomatic responses, leading to hypoglycemia unawareness, increasing the risk of severe episodes in type 1 diabetes. 202. A blood glucose of 60 milligrams per deciliter requires immediate insulin administration. True or false? Answer: false. Rationale: a glucose of 60 milligrams per deciliter indicates hypoglycemia, requiring fast-acting carbohydrates, not insulin, which would worsen the condition. 203. Metformin is typically stopped before surgery to prevent complications. True or false? Answer: true. Rationale: metformin is held before surgery to reduce lactic acidosis risk, especially with potential renal stress or contrast dye use, per clinical guidelines. 204. Hyperglycemia can lead to increased thirst and urination. True or false? Answer: true. Rationale: hyperglycemia causes osmotic diuresis, leading to polyuria and subsequent thirst, polydipsia, as the body compensates for fluid loss. 205. Diabetic patients should avoid wearing socks to promote foot circulation. True or false? Answer: false. Rationale: properly fitted socks protect diabetic feet from injury and maintain warmth, supporting circulation, especially in patients with neuropathy. 206. Insulin glucose is a long-acting insulin used for basal coverage. True or false? Answer: false. Rationale: glucose is a rapid-acting insulin for mealtime or correction doses, not long-acting like glargine, which provides basal coverage. 207. Diabetic ketoacidosis, DKA, can cause abdominal pain. True or false? Answer: true. Rationale: DKA often presents with abdominal pain due to acidosis and dehydration, a key symptom requiring urgent insulin and fluid therapy. 208. A blood glucose of 80 milligrams per deciliter before exercise requires a high-protein snack. True or false? Answer: false. Rationale: a glucose of 80 milligrams per deciliter needs a carbohydrate snack to prevent exercise-induced hypoglycemia, not high protein, which digests slowly. 209. Continuous glucose monitors, CGMs, require replacement every 30 days. True or false? Answer: false. Rationale: CGM sensors typically last 7 to 14 days, depending on the model, requiring replacement well before 30 days to maintain accuracy. 210. A diabetic foot ulcer should be treated with over-the-counter antiseptics. True or false? Answer: false. Rationale: over-the-counter antiseptics can irritate diabetic foot ulcers, which require medical evaluation and prescribed treatments to prevent infection. 211. Type 2 diabetes is always associated with obesity. True or false? Answer: false. Rationale: while obesity is a major risk factor, type 2 diabetes can occur in non-obese individuals due to genetics, age, or other factors like insulin resistance. 212. A blood glucose of 350 milligrams per deciliter in type 2 diabetes always requires for insulin. True or false? Answer: false. Rationale: A glucose of 350 milligrams per deciliter may be managed with subcutaneous insulin or oral medications, depending on symptoms and setting, not always for insulin. 213. Insulin detamere requires mixing before injection. True or false? Answer: false rationale. Detamere is a clear insulin that does not require mixing, unlike cloudy in pH, ensuring proper administration without agitation. 214. Hypoglycemia can be prevented by carrying a fast-acting carbohydrate source. True or false? Answer: true rationale. Carrying glucose tablets or juice allows rapid treatment of hypoglycemia, preventing severe episodes, especially for insulin users. 215. Patients with diabetes should avoid all grains to control glucose. True or false? Answer: false rationale. Whole grains, when portion-controlled, provide fiber and stabilize glucose, making them suitable for a balanced diabetic diet. 216. Diabetic retinopathy can be managed with tight blood pressure control. True or false? Answer: true rationale. Hypertension worsens retinal damage, so tight blood pressure control, alongside glucose management, slows retinopathy progression. 217. A blood glucose of 90 milligrams per deciliter at bedtime requires insulin in type 2 diabetes. True or false? Answer: false rationale. A glucose of 90 milligrams per deciliter is within target range, 80 to 130 mg/dl, and insulin depends on the patient's regimen, not automatic administration. 218. Insulin aspart should be refrigerated after opening. True or false? Answer: false rationale. Opened aspart can be stored at room temperature for up to 28 days, maintaining potency and improving patient convenience. 219. HbA1c levels below 6% are ideal for all diabetic patients. True or false? Answer: false rationale. An HbA1c below 6% may increase hypoglycemia risk in some patients, and targets, e.g., less than 7%, vary based on age, comorbidities, and risk. 220. A patient with diabetic neuropathy should use hot water bottles for foot pain. True or false? Answer: false rationale. Hot water bottles risk burns in neuropathy patients with reduced sensation, increasing injury and infection potential. 221. Sulfonylureas like glympyride are contraindicated in type 1 diabetes. True or false? Answer: true rationale. Sulfonylureas stimulate insulin release, ineffective in type 1 diabetes due to absent beta cells, requiring insulin therapy instead. 222. A blood glucose of 170 milligrams per deciliter 1 hour after a meal is above target range. True or false? Answer: false rationale. 1 hour postprandial glucose below 180 milligrams per deciliter is generally acceptable, though individual targets may aim lower, depending on guidelines. 223. Insulin pumps require calibration with fingerstick tests. True or false? Answer: false rationale. Insulin pumps deliver insulin but don't require calibration. CGMs, used with pumps, may need fingerstick calibration for accuracy. 224. Hyperglycemic hyperosmolar state, HHS, is treated with oral hypoglycemics. True or false? Answer: false rationale. HHS requires for fluids and insulin to correct severe hyperglycemia and dehydration, not oral hypoglycemics, which are too slow-acting. 225. Diabetic patients should avoid moisturizing their feet to prevent cracks. True or false? Answer: false rationale. Moisturizing prevents skin cracks, reducing infection risk, but should be avoided between toes to prevent fungal growth. 226. A blood glucose of 40 milligrams per deciliter can cause seizures in a diabetic patient. True or false? Answer: true rationale. Severe hypoglycemia, below 50 milligrams per deciliter, can impair brain function, leading to seizures, requiring urgent glucose or glucagon administration. 227. Insulin Lispro requires a 30-minute wait before eating. True or false? Answer: false rationale. Lispro is taken within 15 minutes before or after meals, as its rapid onset matches postprandial glucose spikes, unlike regular insulin. 228. diabetic nephropathy requires annual kidney function tests. True or false? Answer: true. Rationale: annual tests like serum creatinine and urine albumin monitor kidney function, detecting nephropathy progression early in diabetic patients. 229. A patient with type 1 diabetes can use metformin as their primary treatment. True or false? Answer: false. Rationale: type 1 diabetes requires insulin due to beta cell loss, and metformin, used for type 2 diabetes, is not a primary treatment. 230. GLP-1 agonists like exenatide can cause nausea as a side effect. True or false? Answer: true. Rationale: nausea is a common side effect of GLP-1 agonists, often temporary, due to slowed gastric emptying and central effects, requiring patient education. 231. A blood glucose of 280 milligrams per deciliter requires ketone testing in type 2 diabetes. True or false? Answer: true. Rationale: though less common, type 2 diabetes patients can develop ketosis at 280 milligrams per deciliter, especially with stress or illness, warranting ketone testing. 232. Diabetic patients should avoid checking glucose during illness. True or false? Answer: false. Rationale: illness increases glucose, requiring frequent checks in diabetic patients to adjust insulin and prevent DKA or HHS. 233. Regular insulin is used for basal coverage in insulin regimens. True or false? Answer: false. Rationale: regular insulin is short-acting for mealtime or correction doses, while basal coverage uses long-acting insulins like Glargine or Detamir. 234. A diabetic foot ulcer can be safely treated with home remedies. True or false? Answer: false. Rationale: diabetic foot ulcers require professional care due to infection and poor healing risks, as home remedies may worsen outcomes. 235. Hypoglycemia is a common side effect of thiazolidinediones like pioglitazone. True or false? Answer: false. Rationale: thiazolidinediones improve insulin sensitivity without stimulating insulin release, rarely causing hypoglycemia unless combined with other agents. 236. Diabetic retinopathy can cause floaters in advanced stages. True or false? Answer: true. Rationale: advanced retinopathy can cause hemorrhages or vitreous floaters, signaling severe damage and the need for urgent ophthalmologic care. 237. A blood glucose of 100 milligrams per deciliter before a meal requires insulin in all diabetic patients. True or false? Answer: false. Rationale: a glucose of 100 milligrams per deciliter is within target range, 80 to 130 mg/dl, and insulin depends on the patient's regimen and diabetes type. 238. Insulin pens should be shared between patients to reduce costs. True or false? Answer: false. Rationale: sharing pens risks infection and cross-contamination, and each diabetic patient must use their own pen for safety. 239. Exercise can worsen glucose control in type 1 diabetes if poorly managed. True or false? Answer: true. Rationale: without adequate insulin, exercise can raise glucose in type 1 diabetes due to stress hormones, requiring careful monitoring and dosing. 240. A patient with type 2 diabetes can develop hyperglycemic hyperosmolar state, HHS. True or false? Answer: true. Rationale: HHS is a complication of type 2 diabetes, typically in older adults, involving extreme hyperglycemia and dehydration without significant ketosis. 241. Fruity breath odor is a symptom of diabetic nephropathy. True or false? Answer: false. Rationale: fruity breath is a sign of DKA from ketone production, not nephropathy, which affects kidneys and lacks the symptom. 242. A patient with diabetes should check HbA1c daily to adjust insulin. True or false? Answer: false. Rationale: HbA1c monitors long-term control, 2 to 3 months, and is checked every 3 to 6 months, while daily glucose tests guide insulin adjustments. 243. Insulin NPH is safe for administration in emergencies. True or false? Answer: false. Rationale: only regular insulin is safe for use in emergencies like DKA. NPH, an intermediate-acting insulin, is for subcutaneous use only. 244. A blood glucose of 200 milligrams per deciliter at bedtime requires skipping a snack. True or false? Answer: false rationale. A glucose of 200 milligrams per deciliter may still require a balanced snack to prevent nocturnal hypoglycemia, depending on insulin and patient factors. 245. Diabetic neuropathy can cause orthostatic hypotension. True or false? Answer: true rationale. Autonomic neuropathy in diabetes can impair blood pressure regulation, leading to orthostatic hypotension, a common complication. 246. A patient with type 1 diabetes can manage with diet alone during illness. True or false? Answer: false rationale. Illness increases glucose in type 1 diabetes, requiring insulin and frequent monitoring to prevent hyperglycemia or DKA, not diet alone. 247. SGLT2 inhibitors can cause weight loss in diabetic patients. True or false? Answer: true rationale. SGLT2 inhibitors promote urinary calorie loss, leading to modest weight loss, a beneficial effect in type 2 diabetes management. 248. A diabetic patient with a blood glucose of 300 milligrams per deciliter should eat fruit to stabilize glucose. True or false? Answer: false rationale. Hyperglycemia requires insulin and hydration, not fruit, which could raise glucose further, worsening control. 249. Regular insulin can be mixed with insulin glargine in the same syringe. True or false? Answer: false rationale. Glargine's unique pH makes it incompatible with regular insulin, requiring separate injections to maintain their distinct actions. 250. Patient education on diabetes includes teaching about the importance of flu vaccinations. True or false? Answer: true rationale. Diabetes increases infection complications, and annual flu vaccinations reduce illness severity, supporting glucose stability and health.